Dr. Sandeep Jain, welcome to ITV Gold. I hope you're doing well today.
Thank you for having me. It's my pleasure.
Of course, we have to have you because so much is happening in the nation with COVID-19 and we need some advice and we need to know what is exactly going on with the vaccine and the surge in cases. So let's start this interview by looking at some numbers that are coming in today. In the United States, we are at 24.5 million cases of COVID-19 and at least 406,000 deaths. My question to you is, why do we continue to see this surge and why aren't we able to contain it in certain parts of the nation right now?
Well, it's almost like the horse has left the barn. Right now we have community spread. The only way that you can prevent it is by two people wearing a mask. Just as an example, if there's a patient who has COVID, he or she wears a mask, there's almost a 74% reduction in transmission. And if the person opposite him or her is wearing a mask, then it's almost 99% reduction in transmission. So masks are the most effective way of preventing transmission. And I feel that if everybody does it, from here on, the curve will actually come down.
Dr. Jain, what are you hearing from overwhelmed hospitals about their conditions? And also, you have a lot of urgent cares as well in New York. What is the condition like on an everyday basis?
Well, in our urgent cares, we are swamped. People are coming in for testing. Fortunately, in the state of New York, we've done pretty good. Testing is widely available. Of course, you have to wait in some lines if you don't have an appointment. I think overall hospitals now are almost near surge levels, the levels that they were in February and March. I think the numbers are climbing every day. I think the only big difference is people aren't dying as much because we now have figured out how to treat COVID, and we are very careful in the hospital in treating patients and monitoring them. Knowledge that we didn't have back in February and March.
You know, Doctor, California is currently the epicenter, but we cannot forget New York here was the epicenter last year around this time. Are you afraid or are you worried about the fact that we may see a surge similar to that, where we may become the epicenter?
Yes, so Southern California has had a surge for some time now. Hospitals have been packed. I think in New York City, if you look at the living circumstances, we do tend to live in big apartment buildings and crowded homes. Where there's more than one family member, of course. So there's a good chance that this might again happen. However, everywhere I go, I find New Yorkers wearing a mask, inside or outside. So I'm pretty hopeful that we'll be able to avoid a surge this time.
What's something that these states that are surging with cases should do right now?
It's very simple. Wear a mask, starting from the leadership all the way down.
Yes. So the Biden administration actually sent out an executive order where now they have mandated a national mask mandate and social distancing on federal property. How important do you think that step is, and do you think the states should follow that as well?
Absolutely. I think it was very key policy to have that. And finally, I feel it's not just the politicians running this pandemic and they're taking the medical advice very seriously. I do think in our country, it's the states that have the ultimate prerogative. I would encourage all those states that don't have these mask laws to actually insist on everybody wearing a mask.
Okay, that's so important. Also, what is currently the condition of PPE available to you?
So in our case, we learned from the February-March pandemic surge, and we started building up inventory. So we in our offices have up to 3 months of inventory that we can handle it. And I'm sure a lot of the urgent cares and a lot of the hospitals have already done it. They've built on the inventory, so we won't be out of PPEs.
Yes. So before we start talking a little bit more about the vaccine, Doctor, I just want to ask you something on therapeutic. Eli Lilly says that its monoclonal antibody treatment could cut the risk of COVID-19. What is your comment, and what is your comment generally on therapeutics being used to curb coronavirus?
So overall, if I look at the broader picture, the day a drug is discovered, just like Tamiflu for flu, if we have a drug like Tamiflu, I think this epidemic will be over. It's the drug that is going to take care of this epidemic. Meanwhile, the only options we have are vaccines to prevent it. And then these therapeutics like monoclonal antibodies, which do seem to work pretty effectively if given in the right patient at the right time. And I've had friends who are physicians themselves who got this and they've done fine. So I'm very encouraged by what we are treating people with in the hospitals. And that's part of the reason why we don't have as much mortality now.
Dr. Jain, we're getting this estimate from the CDC new director, Dr. Walensky, who has said that we may hit 500,000 deaths by mid-February. What are your comments on that?
Yes, that's just the short-term estimate. I think this pandemic is going to continue in waves and surges until all of us as a nation wear masks and at the same time prevent people from coming from outside who have not been screened appropriately.
That's so true. Let's now talk about the vaccine, doctor, because we have a lot of questions here. Number one, have you received the vaccine and what kind of vaccine did you get?
We were very fortunate. We've been working every day since February. Finally, after surviving all these months, in December, a vaccine was available for us healthcare workers. I went and got it in the hospital. They had a Pfizer vaccine. I got my first dose on 23rd of December, and subsequently I got my second dose as well. So I'm very happy that I was able to get it because we are at the front line and our staff was able to get it next. So where we stand today, the vaccine is available for the general public. Again, there are categories. The state has decided 1A, 1B, and everybody who's eligible now can get the vaccine.
Let's talk a little bit more about the vaccine. There is Pfizer, there is Moderna, there's AstraZeneca that's waiting, there's Johnson & Johnson. How are you looking at these vaccinations and how do they sort of differ? And also a question to you following that, Johnson & Johnson's vaccine is going to be one dose only. Do you think that'll be more effective in getting to more people in the country?
So there are two parts to your question. Let me answer the first one. Yes, there's a Moderna vaccine and a Pfizer vaccine, and there's significant differences in both. My personal preference was for Moderna. However, the hospital didn't have it, so I got what was available. And there is a reason for it. Moderna first dose, the efficacy is upwards of 90%. Pfizer, the first dose efficacy is upwards of 50%. I'm a frontline healthcare worker. I wanted to be vaccinated with a 90+% efficacy between the two doses. Now, after the second dose, both vaccines are similar, 90+% efficacy. So that's about Moderna and Pfizer. The second big reason I wanted Moderna, I know it's made in America. It's made by a very innovative company.
Right.
So I would rather support American jobs. The second part of your question about Johnson & Johnson being a one-dose vaccine, I think it certainly will help. However, the key would be something like Novavax or any vaccine that comes out that can be stored in a regular refrigerator, does not need such cold chain requirements, and can be mass distributed in rural areas and far and flung areas in the world. Because remember, it's not just America that needs to be vaccinated. As long as there's still people out there in the world that are not vaccinated who end up coming here or any other country, will keep having this disease.
Doctor, I have to ask you now, before I go into more about what is the vaccine doing and what are the side effects, the rollout for the vaccine is incredibly slow in the country right now. I want to know what your personal experience has been with your urgent care centers and why are we having no national plan for this?
So I think we're living in the midst of chaos. A lot of decisions will not go right. And I think that's okay. All of us should accept that. I think Governor Cuomo has done a great job at distributing the vaccines. In the first phase, they distributed to the hospitals. Unfortunately, hospitals weren't able to get them out as much. And you can hear Mr. Cuomo's response to that. I feel a lot of people in the community were too scared to go into hospitals that have COVID-infected patients. I wouldn't want my mother to be going into the hospital to get a vaccine either. So I think that's predominantly been the challenge. The second challenge has been at a national level. It's very hard to coordinate such a huge event in the midst of a changing presidency, changing government. However, I do think President Biden and Kamala Harris will have a very good plan for all of us.
Right. President Biden has vowed to the country right now that he would, try to get 100 million doses given in the first 100 days. That means 1 million every day. Do you think that's possible?
It depends. I do believe that's a very noble aim to aim for. I can just tell you my personal experience. We got about 1,700 doses. What we did was when we opened them up on the New York State website, the spots were getting filled up very quickly. As you would know, that's the same situation nationally. We also reached out to community groups, religious groups, told them, listen, you need to get your elderly all in one place and we'll come out in the community and vaccinate you. And we were able to finish more than, I think, 95% of our shots.
Wow.
In 4 days, and by the 5th day, we were almost done.
Wow. So are you currently out of vaccine, doctor?
I think today probably my offices might have the last doses being given. And we are hoping, and we've been promised by the state to get us more shots. So our mobile medical van is still in the shop because we don't have vaccines to go out and distribute in the community.
What are you expecting as the timeline for the next doses?
So we didn't get last week and we didn't get the vaccine this week. We were supposed to get a weekly supply. My concern has been when they distribute all the shots, I hope they hold on to the second doses because that's the only way it has been studied to work. And I would want to keep my word with my patients and all the community elders that we've actually given them the first dose, that I would like to go and give them the second dose. The state has told us they're holding the second dose for us. Once we get it, we'll distribute the second dose to people who already got the first dose.
So currently, none of your patients have had a second dose of the vaccine?
No, unfortunately, not yet. But very soon. I'm very excited for them.
And would it give you enough time? I know there has to be a certain time in between taking the second dose. Would that be affected?
So for the Moderna vaccine that we have, you need a 4-week interval. So we started distributing, we finished it last week. So 4 weeks from then, we'll go back and give the vaccine as long as we get it from the state.
All right, doctor, also when we're talking about vaccine, I have to ask you, what are the side effects that you personally felt after getting your first dose and your second dose? And what are you seeing amongst your patients as common side effects?
So the commonest side effect that I've seen in patients as well as myself, you feel a little tender spot. If you touch it where you got the vaccine, it hurts. The next day, you'll feel it a little bit more, nothing that Tylenol cannot cure. And the other common side effect, which isn't common, I would say, it's one of the side effects that we heard from patients. Some of them felt a day of fatigue. Very rarely, and we've had only 1 or 2 people, they actually had a little bit of a rash on their arm, which went away over the next 2 or 3 days. Those 3 are the commonest things that we found. I mean, again, one is very common, which is, I think, almost everybody has that local pain. And the second side effect, fatigue, which is in a small subset of patients. And the third is rarely will find a rash.
We have also heard that most patients are showing more of those signs of fatigue or fever after their second dose. Your comments?
So I think if you take the entire number of vaccines being distributed, the people who get the side effects, they'll be vocal, and that's what will be carried by news media as well. I think if we put it into perspective to the number of doses being given out, it's a very, very small number that have fatigue.
Dr. Jain, who should be getting the vaccine, especially for people that had COVID? Should they be getting the vaccine? And what is the immunity time for these vaccines so far?
So originally the state had said anybody who had a COVID in the last 90 days should not be getting the vaccine. Scientifically and medically, it makes sense because you probably already have the antibodies from the COVID infection. And again, you can get your antibody levels checked. And if you have them in high numbers, you definitely don't need the vaccine. Beyond that, the people that needed the vaccine the most, of course, were healthcare workers. And then you talk about the older people. So 75 and up, if you have a grandparent who's 75 and up, their mortality of getting COVID is between 20 to 25%. You give them the vaccine. In fact, whether you give them a Moderna vaccine or a Pfizer vaccine, after 14 days, 0 cases have needed hospitalizations. So you basically reduce the mortality rate from 20-25% to almost 0 from COVID. So those are the next vulnerable group. Unfortunately for them, the vaccine, when it was released to them, it was also released to a group of other eligible people. So frontline workers, NYPD, fire department, EMTs, and of course our teachers, that's another very, very vulnerable group. They all need to get the vaccine. And right now we have a supply issue going on, a distribution issue going on. There are hospitals that have the vaccine that have not been able to give it out. And then there are clinics like us that got whatever we got and we distributed all of them out.
So, another question about vaccine that's coming in. There are a lot of new variants that have come from the UK and Africa as well. How concerned are you about those variants, especially in New York, because they're saying it's more transmissible? And also, do you think these vaccines, the ones that we already have and the ones that are in the making, would be effective against it?
Yes, that's a very, very good question. As you know, coronaviruses have been around for hundreds of years. And naturally, they keep mutating. This particular variant of the coronavirus is no different in that sense. It keeps mutating, which means it keeps changing its structure. As long as it doesn't change too much in the spike protein, we're okay. Now, a couple of these variants that they found, there is a structural change in the spike protein. And the spike protein is responsible for the human infection. Now, when they looked at the 3D transformational images, they're finding that it is not sufficient, that the vaccine won't work. And they're actually doing studies right now as we speak. This vaccine it's predicted that it would work in the Norway variant, it would work possibly in the Denmark variant, and the variant that's in South Africa. Unfortunately, from a public health perspective, previously this virus was really affecting the older populations. Right now, these variants, they're targeting younger people. And the one in South Africa, for example, is actually targeting teenagers and kids. So it's almost like we now have a mutation for every age group. So from a public health perspective, it's really key to get vaccinated more than ever before.
I have to ask you this now. What are your predictions for the next 2 months in terms of vaccine?
I wish you'd asked me the predictions for the next 2 years. In terms of vaccines, I think the vaccines will keep coming. There are more and more vaccines coming out, Johnson & Johnson, AstraZeneca, Glaxo. I mean, we'll have more and more vaccines available for Americans. So that's the good news. The not so good news is this virus is now in the community. It will probably become just like the flu. It's going to be living with us until we find a drug. I personally don't see much changing until 2023.
What's your biggest advice to our audience right now that are still waiting for the vaccine and are worried?
I would say not to worry. The American government, our state government is going to take care of you. They're doing a phenomenal job in communicating with providers like us. They're doing a phenomenal job in supporting people like us. We're going to get the vaccine to you. Meanwhile, you survived since last February until now. This is not the time to give up. This is not the time to let your guards down. Wear a mask, insist on a mask. And also make sure you stay 6 feet away, because the virus gets transmitted through saliva that's thrown in the air when you talk. When you're 6 feet away, your chances of getting contaminated is very low. So if you did those two things right, you will still remain safe, and we will be able to give you the vaccine.
Right. Yeah, I just have 2 questions left here for you, Doctor. I have to ask you, healthcare system right now is so overwhelmed. They're still trying to figure out what to do. Now we have a new administration that is taking our country at one of the most awful parts of COVID-19. According to you, being a medical professional, being a doctor, what is needed to really fix this healthcare system? What are the things that you have found that are missing throughout this entire pandemic?
I think the biggest thing is this pandemic was a medical issue. Medical people should have been giving advice. It became politicized so much that politicians have been running with it. That's one. The second issue that I have is when we distribute these vaccines, we need to be in touch with the communities. These vaccines typically are given by primary care physicians, family physicians, pediatricians. When the government decided, for example, in our state, when they decided to distribute these vaccines, they should have engaged community leaders, engaged religious groups, minority groups. And one very big challenge that was overlooked, and I don't think it was on purpose, it's just what happened. Immigrant homes are generational homes. Grandma, grandpa lives with grandson and granddaughter, right?
Right.
When they give them a hug, they can get the infection. What they didn't realize is, yes, we vaccinated all the elderly in nursing homes and adult homes, but the healthy 75-year-old, the healthy 65-year-old that's out there living his life with his family, with his grandchildren, how do you get the vaccine to them? And in that sense, we could have done a little bit better planning, because if you're engaged with the communities, if you're engaged with the minorities, we're engaged with the religious groups, and just take their input. How are we going to get this to all the 75-year-old?
Yeah.
How are we going to get this to all the 65-year-old in your area? And then distribute it based on that. We would have had a very, very easy rollout.
So here's to hoping that this new administration does a lot of work and helps us out to get out of this pandemic. Finally, my last question to you has been, Statcare has been doing a lot of work for the community, especially with vaccine. I know that people can go and find a lot more information on your website as well. Tell us what you have been up to in terms of giving vaccine out to community members, and what else can we look forward to from Statcare?
So what we did was we engaged the school districts. We have several dozen school districts that we're talking to. One of them made the decision pretty quickly enough, so we went and vaccinated 250 teachers. Because we think that our teachers should be our number one priority as well, because they are at very, very high risk. The second thing that we did was we engaged with community leaders, and many of them are on the board of trustees of temples, synagogues, churches, you name it, gurdwaras. And we've sent the word out through them to get them together, get a list ready, have those people in a public place, a hall or something, and we bring our mobile medical RV to them, and we vaccinate all of them. Many of them actually got together instead of like saying, okay, just do it for our group and versus somebody else. 14, 15 different organizations, for example, combined their efforts, brought in their elderly, and we just went and vaccinated all of them at one time. I think vaccines don't belong in institutions and hospitals. They belong in community doctors and community doctors' offices, and they should be given in the community out there so that the person coming in doesn't have any risk.
Yeah.
Nobody should be made to go through a hospital corridor in fear of risk or get into an elevator afraid that they might get COVID from that.
You know, I have to just one more question here, follow up for you. How did the community members react to you making it a fact to get there and, you know, getting them vaccinated?
Well, there were tears in their eyes. We got a lot of hugs. Their children cried. They've been really, really not being with their parent, who's an older person. One grandmother said, I haven't hugged my grandkids in almost a year, and my grandson is going to college tomorrow. I can tell you stories after stories. There have been elderly that have been trapped, locked inside their rooms, only gone out once or twice, and they can't meet in social groups. They can't go to the synagogue. They can't go to the temple. They can't go to gurdwaras. They cannot meet other elderly. They can't even travel back to their countries, India, Pakistan. They just can't. They're feeling trapped. And this vaccine was like a lifeline for them. So we got a lot of blessings from our older community, people. Even in our school district, our teachers were very, very thankful.
Yeah.
The teachers that we vaccinated. And we're continuing to do this work. And in our offices, you will not believe, the minute we have a cancellation, there's a wait list of 50 people. We call the next one, boom.
Wow.
And the person comes in and takes the vaccine. So it's been going very, very well.
Well, thank you so much for your time here on ITV Gold. I hope the audience follows your advice, and good luck to you with Statcare. I hope you keep on helping as many patients as possible.
Thank you. Thank you for having me. It was a pleasure. Good luck to you also.
Thank you.